video off.
Yeah, man.
People can see it now.
Testing. Okay. Mhm. Jaden, are you being the host now?
Yes, I'm the host.
Can you disable the entry and exit tones?
Oh, okay, sure, all right.
All right, it's exactly 4 p.m. Welcome back, everyone, to the second day of the second session of the Asian Symposium. So I'm your moderator for today. My name is Mia. I'm from IVSA Malaysia, Kelantan. And first and foremost, I would like to extend my deepest gratitude to all the IVSA member organizations of Asian region and IVSA Nepal for organizing this symposium and for giving us this opportunity to be here today. For the viewers who are joining us for the first time, this online symposium is organized by IVSA members, also known as the International Veterinary Students Association, from all over Asia, which consists of 16 lectures on various aspects of public health and zoonosis by renowned speakers from different parts of Asia, which will be held over a duration of 4 days. We have 2 sessions each day, a morning session and an afternoon session, with 2 presentations in each session. Now we are heading to the 7th lecture for the symposium. So before introducing the speaker, I would like to put forth a few instructions, so I hope everyone could pay attention. So participants can ask their doubts and queries in the chat box in WebEx, as well as in the YouTube chat box, which will be answered by the speaker at the end of the presentation, if time permits. Participants will receive a lecture code or an attendance code during the session or after the session, which is an important code to note down for getting the certificate for this particular lecture. So the link to generate your e-cert will be emailed to you in the course of the next 4 days. So please be patient and hold on to your code. Please keep your microphones and video cameras turned off at all times if you're joining us from WebEx. And lastly, please maintain decorum throughout the session. So now I would like to introduce our speaker for this session, Dr. Sandy Chung Siu Shan. So Dr. Sandy has 20 years of experience in zoo and wildlife animal medicine and ex situ management, having worked as veterinary officer at Zoo Taiping, the Night Safari, Zoo Melaka, and the Department of Wildlife and National Parks. Dr. Sandy joined the Faculty of Veterinary Medicine, University of Malaysia, Kelantan as academia in 2011 and gone through extensive training in bioinformatics and molecular characterizations of the mammalian transcriptome in multiple species, including livestock and wildlife during postgraduate studies. She was the person in charge of zoonotic diseases and public health research laboratory in Faculty of Veterinary Medicine, University of Malaysia, Kelantan, and the deputy head of zoonotic disease and public health UMK Interdisciplinary Research Cluster. So Dr. Sandy currently holds the position of Deputy Dean of Academic and Student Development in Faculty of Veterinary Medicine, UMK, focusing on the Doctor of Veterinary Medicine program curriculum, teaching and learning to ensure the UMK's veterinary graduates are able to meet the industry's needs in the local, national, regional, and even global market. She is the course coordinator for wildlife and exotic animal medicine, clinical practices, besides involved in the teaching of other courses such as lab animal diseases, veterinary surgery for exotic pets, and at university level, Dr. Sandy is one of the UMK Institutional Animal Care and Use Committee, also known as the IACUC, that oversees animal use in teaching, research, and conducted in accordance to the university rules and regulations. Also adhered to the Animal Welfare Act 2015 of Malaysia. So additionally, she is a member of university's Biosafety and Biosecurity Committee, which is responsible for monitoring and assessing the use of biological materials in research that will not result in any detrimental consequences to humans, animals, as well as the environment. Sorry. So now I would like to introduce, so now let's have Dr. Sandy take the stage. to present her topic on veterinary occupation and zoonosis, risks and hazards. Thank you.
Okay, thanks for the introduction, Mia. So I hope you can hear me well. Yes. Okay, good day. So it could be morning or afternoon, evening where you are. So I've been given the topic to talk about veterinary occupation and zoonosis, the risks and hazards. So I'll be focusing more on the zoonosis part of the topics. Okay. All right, slides are not moving. A bit issue here. I'll stop sharing. Okay, doesn't seem to be moving. All right, okay, good. How it's going. So this is the outline of the my presentation. We'll start with the definitions. Then we'll talk about the different types of hazard, the risk factors, and most importantly, how could we reduce hazards and risks for veterinarians. So first and foremost, what is zoonosis? These are, as we know, are infectious diseases that can be transmitted from animals to humans, and sometimes vice versa. Hazards are any source of various materials, and they come in different forms that could potentially cause damage, harm, or adverse health effects. So in this case, particularly to veterinary staffs while they are at work. And risks are what we term as the chance or the probability that the person could get harm or have an adverse health effect when they're exposed to different types of hazards. And occupational hazard would be a risk that come as a result of the job or position that we have, particularly in the veterinary profession. We'll have quite a number of it, which I'm going to go into more detail. Okay, so different types of hazard. There are mainly three types. Biological. So this would include bacteria, viruses, fungi, parasites, prions. Then we'll come to the physical hazards. These are particularly mechanical trauma, which could be due to the work that we do. Let's say we have to carry a heavy dog up to the examination table. We need to lift materials, or we need to put our hands in to the animal's rectum to check for any abnormalities, or even for pregnancy diagnosis, those type of hazards. Okay, we'll go into details later. Then we do have chemicals, but these are not zoonotic in nature. And another way is because we are doing radiography, so those are radioactive materials that could also bring into hazards to us, right? So now we go into more details. So biological hazard, we can inhale them. So if it's, let's say, the airborne viruses like what we have now, like in flu, okay. Direct contact from infective animals, because sick animals, they may shed the pathogens in the blood, saliva, feces, urine, mucus, and etc. So if these materials were touched with unprotected hands and all, or accidentally get into our face and all that, so we might get infected. Indirect contact is materials or the environmental matters that are contaminated because these infected animals are there. So things that they have used, such as the food trough, the water bowls, aquarium water, well, if they are being cleared while you're trying to take the animal out, cages, the coop, enclosures, or the water and soil. Ingestion, this is intentional. So if hygiene were not taken good care of, so you might get accidental ingestion on the food or on the water. All right, so just to get things started, so we'll go on with the first poll regarding zoonotic pathogens. Aiden? Yeah.
Good day, doctor. I will need a few minutes to type it out. Okay. Just 1 minute. Doctor,
Mhm.
I think I unable to present the poll because you are presenting, but yeah,
Okay. In that
yeah, but
case,
mm, sorry, doctor.
right. No, never mind. We just go on then. Because, unless if I want to type out, then I will get out of here. Yeah, maybe we'll do that at the end lah, later. Okay, so let's continue. So the different categories of biological hazards, such as bacteria. I guess like if most of the vet students, they would have heard of all these diseases. So in bacteria, they are. So the list are not exhaustive. These are just some examples, such as in bacteria such as anthrax, brucellosis, Q fever. These are the among the top pathogens of pathogenic diseases, zoonotic pathogens that we are concerned with. Viruses such as avian influenza, dengue fever, Ebola viruses. Fungi, there are more, but sporotrichs is one that we are very much concerned with because it would cause deep ulcers in the pets as well as in the owners. Whereas like dermatophytes and all that, it's more superficial and generally would not lead to perhaps secondary infection and all that. Not really, right? For parasites, we have Toxocara that there are larval migrants that might go into the eyes and all that. So pharmacies that might lead to miscarriages in pregnant ladies. And in Malaysia, this Plasmodium nosai malaria, or commonly known as monkey malaria, is now the top malaria infection in Malaysia. In terms of prions, probably not so much in Asia because we tend to cook our meats to, in fact, we tend to overcook them instead of just cooking. So bovine spongiform encephalitis, which is believed to cause variant Creutzfeldt-Jakob disease in human. Right, so these are biological. Mechanical trauma, so they are not themselves zoonotic, but because of the nature of the injuries that they may cause, so they may transfer infective agents from the host or like factors for mites. So especially when if you have a break on the skin, so these are like opportunities for pathogens to enter our body. So examples such as you might get bites and scratches from animals. Needle stick injuries. So this is important because you can see on this image. Let me get to the. They're not responding. Never mind. So you can see the points of the hypodermic needle is very sharp, not just at the tip of it. Even the sides are actually sharp enough to incise through your skin. So if you have like a needle stick injury like this, so if the needle has any infective materials in it, so there is potential that the person that suffered the needle stick injuries may get the infection. Okay. So bites and scratches, the risk that it covers to animal handlers, which including vets and assistants and any staff that handles animals. So number one definitely is tissue damage. It could be just minor wounds, like in the pictures just now, just minor cuts and scratches. But if let's say it's a bigger animal or it is over a bigger scale, so you might get substantial tissue damages. Not just from the trauma, but potentially if let's say it's venomous or it is caustic, so you may get necrotizing wounds and all that. Okay. All right. Then on top of that, you may get secondary infection because of the scratches and bites, not just from the animal that bitten or scratched the person, but also because there's a breakage in the skin layer. So any pathogens that exist in the environment may contaminate the wound and cause secondary infection. Okay, proper handling. This means the staff that are helping the vets, for example, to handle, to restrain them for sampling or for treatment, right? So this needs to be trained. So I believe none of us are born to know how to handle a feisty cat or dogs. Okay, so you need to train that to use certain techniques or equipment to restrain the animals to prevent any injuries to the staff. Okay, as for the risk factors, so number one for age. So the longer a person has been working in the place, so there could be cumulative and repetitive exposure to pathogens. So it could be depending on the work that you have been doing. If it's, let's say, if it's research, perhaps it is restricted to what's being done in the animal research laboratory. But if let's say you are working in a small animal clinic or in a farm, then you get more exposed to different types of pathogens as the animal comes in. It has been said that in old age, so person that is in that's more elderly, they have generally the bodily function is compromised, particularly the immune response. If a person has any underlying disease, such as diabetes, mellitus, cardiovascular diseases, renal diseases, it's very likely their immune system is compromised as well. Research have shown if a person is smoking or consumes excessive amount of alcohol, so I can some people might say they can live on with very minimal amount of sleep, but it actually would affect our bodily functions physiologically. And if the person is constantly being stressed at work or if they have personal issues, so those also will increase the probability of infection compared to others. Okay. In terms of gender, so it has been researched so I only show one or two references here. In fact, there are many studies that show that during pregnancy, the women do have compromised immune response. And in normal circumstances, because female would have the hormonal cycles, so sometimes it was believed that this put a lady at more infective risk compared to men. But there are more current research that actually showed that the ups and downs of the different hormones actually is protective against some disease elements, such as in this case Q fever. So the reason is because the interplay between estrogen and progesterone, they at different times will reduce inflammatory reactions. Initially it is good because inflammation means the inflammatory cells are coming in to destroy the tissues to get rid of the infection. But when the inflammation is reduced, so you have less tissue damage. However, if it's an anti-inflammatory reaction is coming, um, in turn, it will reduce the ability to ward off infection. So there's a very fine line of balance between this. Okay, for progesterone, additionally, it has been shown if for repeated infection, it actually reduces T cell responses. For males with age, they have found that lower testosterone level would have a possible higher inflammatory reaction, and there's a loss of control in viral replication. So viruses can replicate in the older men with lower testosterone level. So in that sense, the infection will be much more severe. From the social and cultural view, some work has been traditionally viewed to be more suitable for ladies or more suitable for men. So this would, in a way, give more or less exposures to pathogen. So let's say in some parts of the countries, they will say that the women are the one taking care of the livestock. So in turn, they are much more exposed to pathogens from the animals. Okay. So now we come to the part about how to reduce hazard and risk. what we can do is there are multiple parts that we can reduce risk on the example. So let's start with personnel. So for me, personnel is always, if not the most, is one of the most important assets for a organization. So what we can do is number one, health checks and screening, especially when they first came in. And after that is, if it's possible, we can do annual health checks, because we are constantly working with, we are constantly being exposed to various pathogens. So it would be good to have annual checks. Vaccination. So we always, especially in small animals and livestock, we always emphasize on the importance of vaccination for our animals. But a lot of times we may forget that actually the staff need to be vaccinated as well to get them protected against all these different pathogens. So here I list a few that you may consider, such as hepatitis, rabies, tetanus, and others. Okay. In fact, there are work to say that perhaps like veterinary worm as well, as we do come into contact with the and from the soil of their enclosure. Okay. The personnel aware of the possible hazards that is associated with work activities, and they need to come to know how to control or reduce the hazard and risk on themselves. There are or standard operating procedures that they need to follow. So these are not created to make life more difficult, because it sets a lot of restrictions on you can do this, you can't do that, and all that. Engineering controls, these are mainly on the design of the workplace, the different things like ventilations, the airflow, and things like that. Work practices, we go into this, so how things are being done, and personal protective gear. So they have to be made aware that all these are in place to help them to reduce the risk and hazards they would face. So the staff personnel should have should be trained well, so that they have the skills to conduct any work procedures effectively and proficiently. Number one, not just because we need to get work done in a good pace and well. Secondly, it's also to work safely, to know what to do and when to do it. Okay. So this is important. Training is very important, especially for new staff. It's considered as an orientation, and they may take maybe some time for them to get proficient with the skill that they need to acquire. However, for existing staff, so they should get reminded, or should get repeated trainings, because with time sometimes people get more complacent, and sometimes people forget. Okay. So in the facilities or in the building vet clinics, or we can have something like this. I know this is this is actually a bit heavy. So if you can have, let's say, it's a short, small so particularly food chart, those are generally quite useful. So we just follow what should be done, or who to call, or who to talk to, who to report to. when things like this happen. So give very clear and short instruction of what and how and when and who. Okay, so if we include a number like this, that would be quite useful for people to, in terms of, because in terms of emergency, even the information that you use, you think that you remember for very clearly at doing perhaps a poster that you can put in the workplace. Okay, so continue on with personnel. Hygienic practices is very important. We always emphasize that they need to wash their hands. So with the current COVID-19 situation, everyone has been told to wash hands, and for at least of 20 seconds. But I think in the veterinary staff, we have always emphasized that hands is very important, even if we're moving from one animal to an animal, so we do not action or contamination between animals and between the animal things that we use. And very importantly, not to touch any part of our face, particularly mouth, the eyes, the nose, even hair, after we handle animals, because these are potential. The orifices, of course, those are the most important because into to our body. Okay, if staff or even student are particularly ill, so we will not we will allow them to take medical leave to work or to other practical. So to the colleagues, or if it's zoonotic, may cause in between animals, and the person's immune system is already down at that time. There's a open wound on the hands or any part of the body, so extra precaution definitely has to be taken, because again, that's an opportunity for bacteria to get in. So now I know now, like, mobile phone is so convenient. You can use it to take pictures, to take notes, even the calculators and all that. But in KVUNK, like our veterinary clinic, we do not allow students to use mobile phone unless like they need to take pictures of the patients for their reports and all that. Even so, like best to assign just one person to handle the phone for the yeah. Because we always forget and then we put it in the pocket. And then I think it's not often that we disinfect our mobile phones, and it's not all phones can be washed, and particularly not with soap. Okay, so that's one way to stop the spread of contaminate your personal belongings. And phones are being carried out from the clinics. I would say that you would change your clothes and all that, but all the PPE will be left, but your phone will be with you from the time you get in until you go out back home and to go outside and to eat and all that. Okay. Then we come to PPE. I think most of you all we know. The different types. So most common ones are like latex glove that we use when we're handling any biological materials or animals. Animal handling protective gloves. These are thick gloves that I won't say 100% remove the risk of getting bitten, but like the damage is much more. So the wearing of lab coats, clinical wear clothes, we put on face masks. Generally in clinical settings, 3-ply good enough. Unless you work in very infective, you know that you are handling very infective materials, then you might go for N95. N99 generally are for laboratory research use. They wear. So over there, they will have different types of depending on what materials they are handling. So they will have different levels of biosecurity measures. Okay. Face shield, such as this one, to give extra protection, and you put on safety goggles. Okay. I think we'll just skip the poll because it's very late reaction. Okay. Okay, so that is on the personnel view perspective. So the employer or the person in charge of the organization and the employees should take note of that. So but for the management and facilities, these are the things that we identification of hazards and risk assessment. So each organization should know where and what type of hazards they have, and you should do a risk assessment. How much risk that the staff or the students that will face. So we can do periodical checks and audits. These are generally done in official government and some big organization, they will do it. So like the private practice, they may not do this as a requirement, but it's good that we have checks from time to time. So it's best to always put it into the system, so it won't be forgotten or neglected. So we should get detailed information of the activities, pathogens, infection, occurrences if there is, and in different settings they would be different. In a veterinary clinic or veterinary hospital, generally it's relatively clean, and unless the animal besides the animal that they are infected. Okay. For farms, you not just worry about the animals, you worry about also the environment, because it's generally you'll be dealing with soil and water source from outside. Vertical gardens, you have multiple species that is actually kept in relatively small areas. Okay? So there could be a cross of different pathogens between different species. In laboratory settings, this is generally much easier to manage if it's done properly, because we should know like what is being done, and if we are introducing any infectious pathogens for research, we know the proper procedures that we need to take to reduce the hazards and risks. In the field, so these are like as I have done before as a wildlife vet, you go out in the field, so in the forest or in the jungle, you need to rescue an animal, or need some will do observations, or they need translocation of animals. So you're exposed to different types of hazard and risk that sometimes it carries a much more deep the planning and the thoughts that put into it must be more, because the unpredictability of things that could happen is quite large compared to the ones above. Okay, so intervention has to be taken to reduce or remove the risk that will be faced by the staff and students and all. I will explain further outside, further. So design a workflow. So if it's possible to design the work area to be dirty and clean. When I clean, it's not just about dirt, or it's more about when we talk about when the infective and the potential hazards of the work and materials that's going in and out. So in this case, so clean, that means if a worker has just came in the morning or whenever they start their shift. So this will come in. So it's considered clean. So once they go into the animal areas, they start to do some work and they get contact with the animals or the materials that they have, they do cleaning and all that. So when they go out, that's considered dirty because you have there's potential contamination from the animals or materials that you have touched, and you go out a different building. Go out the building in a different exit. Okay? If they have done, they have washed up. Depends on how strict is the rules. Change their clothing and all that, or they need to wash up. So it depends. So this kind of create a area where there is no cross contamination. But I think very often most areas we have a open work flow, so it's a crisscross clean and dirty materials. Okay? So in that case, we have to be even more vigilant in the hygienic practices of the staff, right? Okay. In terms of building, to design it so that there'll be a staff area, so areas for them to rest, for them to sit, which has nothing to do with animals. So it's best to separate that out. Have the animal room, so where you have the cages or racks or whatever, places for you to do the procedures. Quarantine room. It could be a enclosure. It could be a paddock. Okay. For newly imported animals or newly animals that has required, so they will undergo quarantine over a period, let's say 2 weeks to 1 month, depending on the disease that we are interested in. And so they'll spend the time before getting into the general population of the animals. Okay. Storerooms, wash areas, designated lab areas. Plant rooms, this is not plant in terms of the green stuff. Plant is more like the where we have all the major machineries like the filters and all the servers, electrical stuff, okay, that controls, let's say, the ventilation, air conditioning, and the corridor. So you should call this to particularly the size. So you have to think about what is moving in and out of the area. So is it big enough? Is it small enough? Is it too narrow? Okay. Ventilation, air circulation, air filters. So a lot of buildings, they have centralized air conditioning. So do you have filtration, particularly in the animal areas? So is the air being shared between the staff area and animal areas? Okay. Biosecurity and biocontainment. So we worry about this safety means to prevent any pathogen coming in. When we talk about biocontainment, is prevent any infective materials or hazardous materials from getting out from our cities. So how do we get rid of the waste? That's important. So in the laboratory setting, we have used equipment such as a manifold hood. So this has an exhaust up to get rid of the fumes and gases or toxic materials. And we have a biosecurity cabinet. This one has a laminar airflow, which will filter off the air, and this is where generally we do infective research work. Okay. Animal research facilities, these are individual cages for research animals. So each one of it is a cage, and the air is actually filtered in and out the cages. So this gives an extra protection towards the staff as well as the animals. I think lastly is work practices. So in an organization, we may have staff that are not dealing with animals, such as the administrative staff, clerks and all that. So if possible, very likely they are not even trained to handle animals. So they should not be given access to the animal or the service. it's good to put hazard signs and reminders on the walls. PPE definitely a must for any people that is handling animals. Okay. Appropriate methods and disinfectants to contaminate equipment, services, the waste. Waste can be disposed in biohazard bags, or being some is you use incinerators, some we use bins and all that. And work services is always important to clean. So if you are not sure, it's better to clean more than less. Okay, so we can't really. Of course, the instruction has been given before work, before leaving for work, from work. So all the services should be clean. But just in case, just before we should more time. Posters that my students have made against that give quite nice information about hazards that we can get from animals. Okay. So these are things that you can put on. And okay, so if possible, you can reduce or limit the use of sharp objects. I think it's impossible to eliminate because we are using needles and scalpels. So, but if it's certain procedure that do not require the use of sharp objects, we try to minimize it. Definitely use glove. So in this example, this is actually a anti-puncture or puncture resistant glove, if it's available, but not so much. I've not really seen it in the country yet, but this material do exist. Okay, so you can see it's actually sharp. And this is sharp bin. I think most of you have seen it. This is why we dispose of all the sharp. So instead of just putting it into the general garbage, we should put it in the sharp bin so that it protects the staff that are handling the waste. Okay. So nowadays we do have retractable needles. Obviously, it would cost more. So this is after use. We are most of the hypodermic needles now that we have is a single use, but some practices they actually use it after they boil or they disinfect it somehow. Not a good practice, but I know some people do it. But if you're using this type of retractable needles, it's only definitely use, because once you use it, the punch would be retracted, and the needle sometimes they just break and retract back into the syringe, so you can't use it for the second time. Definitely. Okay. To handle animals with care. So there are different ways that if let's say a small animal that can be restrained physically possible. If it's not, you might need to sedate or anesthetize the animal first before you can do some work. So these are examples of how animals can be materials that you can use to help in reducing the risk of infection, injuries from animals. Okay, so this is the catching pole. You can use nets, you can use a catcher, can use our commercially available or homemade darts and dart guns, blow pipes to deliver the anesthesia. Sometimes we capture the animal first, then we deliver the anesthetic materials through hand injection. But if it's a big animal that tend to be vicious, they will attack us before we can handle them. So it's best that we anesthetize them first. The use of, like, in dogs we use the muzzles, in cats we use towel, rabbits they have their own type of restrainer, for rodents even. So for snake you have a snake tube. So snake generally, if we take care of the head, the rest of the body is generally not so threatening, right? So there are different ways how we can catch an animal. So let's say for the most dangerous part is the mouth, the beak. And I say for eagles, the most important part of their body is the talon. So if we know how to capture them, then we'll have a lessen the risk on ourselves and our staff. Practices, these are also hygienic practices, not to eat, drink, smoke at the work areas, particularly when there's you're doing animal work there. Do not touch your face and mouth and all that. Protect it against splashes and splatters. So just do the goggles, the face shield, and fluids especially, because they tend to spill and splash. Sometimes became aerosol. Okay. If possible, work where is laundered at work and not be taken home. But understandably, I think most university we cannot afford to wash the clothes that the student wear. So, but at least you change it after, let's say, your practical. Let's say you visited a farm, so come back to faculty. We do have changing rooms, student rooms for students. Change it and put it in bag and take it back and wash it immediately. Okay. So I think in conclusion, it's always safety when you talk about hazards and risks. So the organization generally do our thoughts, especially university, because we're trying to inculcate the best practice to our students. So always think about what is best that, for the staff as well as the students. So number one, I think always think about personnel, and then we go down to design the facilities, and buy equipment that would important to safeguard our safety, and then put the work practices in that reduce the risk hazard that being faced by the staff and the students, everyone else. Okay. So these are some references. There are many more that I have not listed. So with that, I think that's all I have for today.
Thank you, Dr. Sandy, for your very informative presentation. I was just wondering if you would like to proceed with your polling, or you would just want to proceed with Q&A.
Oh, okay. I can do perhaps one. Let's see if we get this to work more. Oh no. Okay. Answers. Let's see. Ooh, gosh. Okay, never mind. Okay. I'm not sure whether you can see the poll. So maybe give 2 minutes. Hmm. Hmm.
Doctor, would you like to answer some questions?
Yeah, I'm trying to.
Well, I can read out for you. There's some couple from YouTube and some from WebEx.
We have to. There's a question about we have been the hazard. Why is it still happening? Answer. Because it's so at times you do mistakes and at times like if you're it gets really hot, especially if you're in the tropical countries. You know that how hot it can get, how humid it is. Sometimes people just tend to be reluctant to put on many layers of PPE. So I would say it boils down to mainly human errors or carelessness. Sometimes it just happens. Sometimes it's accidents. Okay. So I would say that would be my answer. So we try to minimize as much as possible, but it's really not easy to eliminate completely the different hazards. So question from Ahmad Bayu, Karyawan, Indonesia. Animal processing food, medium risk. I think this one different countries will have different authorities that take care of food processing. Some may be given the task to the medical people. Some are given to the vets. But unfortunately, there's even over here, there are sometimes village slaughtering that is not being monitored because they do it behind their backyard. So it's not quite hard for us to really monitor that. But yes, veterinary input is definitely important when they talk about food processing. I think because of the lots of emerging diseases are zoonotic nowadays, so the medical partners are much more aware about zoonosis compared to when I was a student maybe 30 years ago. At that time, I think the medical counterparts, they are not really much aware about zoonosis. Okay. What's the infection not happening? It's not actually happening. Glass fringes, I think these are in the, this is probably inherited when before plastic is so available now. I remember, I think in the olden, much older times, maybe 30, 40 years ago, glass fringes are used because they can be cooked, they can be boiled to disinfect them. So these are not one-time use fringes. Okay. So I think most practices are no longer using this, but they could be some that are still. I'm not sure. Biomedical waste hazard. There are different categories. Is it let's say for the when we like latex glove that were not used to handle infective materials, they are very often disposed as general waste, like paper paper towels that we use to clean our hands just after washing the hands. So those are not infective materials. So they are generally disposed of as non-infective waste, as general waste. The let's say syringes and other materials that are deemed infective or they are biological, those are potential biohazard. So they will be put into a biohazard bags and disposed as biohazard, which we have companies that come in to take them out and incinerate them in their facilities. I think previous practices they have been burying this biological waste, which is not really a good practice to do for now, because there are not that many places for you to bury, and if one day people excavate those areas to, let's say, to do construction and things like that, then you expose the people and the surrounding areas with this biological waste. The infective waste definitely has to be incinerated, disposed of properly, and the sharps, I showed you before, you have sharp bins that you can put in the scalpels and needles and all that. Any more?
There's a question from YouTube.
Yeah.
He
Yes.
asked, what should we do after being exposed to a cattle that has been positive of anthrax?
Okay, I think it's the first thing you need to get to a hospital and you need to inform the authorities, number one, of the cattle that is infected, and the authority will have you take actions. I think generally they would have to bring in a team to close off the area to check the other animals, and the person that's will be exposed would be isolated. They will be taken to the hospital. So let's say if you can't isolate yourself along the way from where you are to the hospital, it's best to stay put and isolate yourself on site. And hopefully you would have ways to contact the hospital people or the authorities that they can advise you whether you to stay put. They will send an ambulance to take you over, like that. Okay, but very importantly, must be reported if there is an anthrax case.
All right. So another question is, can a needle that was used to draw rabies vaccine cause infection?
No, because rabies vaccine is a dead vaccine. It should not cause infection. But of course, I'm not saying that you should use the needle for something else. Okay.
Okay, Doctor. I think that's all for the question and answer. Do you have anything to say before,
Okay,
especially with the polling?
poll ended. So majority answered the infectious diseases research. That is 81 over 221 participants. That is the number one. Next is wildlife medicine. That's 72 over 221. Next is livestock, 3. Surprisingly, small animals is only 18. Okay. Possible. So infectious disease research. If the protocol has been followed correctly and the personnel is wearing the appropriate PPE and they are handling the materials in a biosafety cabinet like the one I showed, the risk actually should be quite low. If let's say you're not dealing, you're actually using the DNA or the RNA extracts, these materials are no longer effective. So it depends on what type of research you are doing. If let's say it is actually I did not specify which type of pathogens. If let's say you're dealing with things like Ebola, rabies, yes, that is very risky. But if you follow the protocol, you minimize the risk a lot. Wildlife, yes, because from wildlife there are so many things that we don't really know about wildlife. They are carriers, but they are not sick. So a lot of times I think that is one of the reasons why we worry about zoonotic diseases from wildlife, because it's just a lot that we don't know about it. But don't be petrified to handle wildlife. Of course, you wear your PPE, but generally the load that's carried by the wildlife is usually relatively low. So if their shedding is not most of the time it's not an infective dose to human or any other animals. It's when it's being transmitted to like for example SARS. Why is it being so effective at that time? Because it was transmitted from they believe on civets, then it goes to humans. So there is some genetic changes that make it so easily infectious. And in the case of, let's say, Nipah virus, if some of you remembered, it is believed from the bats and is being amplified in the pigs. So that kind of increased the dose that is being shared by the pigs to maybe hundreds or even thousands fold, that easily infected humans. So the bats have had Nipah virus all as even before we know about viruses. So they have been having it maybe for millions of years. But why is it that humans were not infected? So there would be some sort of interface that get the pathogens to a high enough level to infect. So that's when you get outbreaks, right? Farms and small animals. So generally, most of attendees feel that they are not as risky because more probably because we generally know most of the diseases that these animals have. We kind of know where they are from, and a lot of times the viruses and bacteria of these particular viruses, they are quite host specific. So let's say a parvovirus from or herpes, even a herpes virus from an elephant, it will not infect human. Okay, like the herpes virus that is infecting human. Okay, so I think we are over more than 1 hour.
It's okay. So I think that's all, sis.
Yeah, so I think there's no more question, right?
Yeah,
From
I think we covered most of it.
Okay, so I hope this has been informative and insightful for the attendees, and
All right.
you have taken some take-home messages. So always think about safety first, especially vets. we are constantly bombarded by pathogens and potential risks at all times. Okay, with that, thank you.
Thank you so much, Dr. Sandy. So the attendance code for this session is already written in the chat box, but in case anyone missed it, it is PT3ZAT. I repeat, PT3ZAT. And it's already written in the chat box. You can scroll up to find your attendance code, and please hold on to it. The links for you to get your e-cert will be emailed to you in 4 days' time, so please be patient. So that's all from IVSA Kelantan, and let's give a round of applause to Dr. Sandy. Thank you so much for joining us today. And I'll pass the stage to IVSA Philippines, Nicola, who will be hosting the next speaker. Thank you so much, everyone. Stay safe and have a nice day. Bye.
All right, can everybody hear me? Okay. All right, welcome everybody to our last lecture for today. Firstly, we would like to thank IVSA Nepal for hosting this wonderful symposium and all the IVSA members from Asia for making this possible. Before we begin, I would like to introduce myself. My name is Marge Firma, and I am a member of IVSA Philippines. I have the honor of introducing our speaker for today, and with me is my good friend Nicole Manalili. She is a part of the organizing committee and will be moderating and assisting our speaker throughout the presentation. Okay, for all of you joining in and tuning in for the first time, we would like to welcome you to our online symposium organized by the members of IVSA all across Asia. This symposium is composed of 16 lectures, which are held over a duration of 4 days. Currently, we are on the 4th lecture of the second day in this afternoon section. A few reminders for the participants. If you have any questions or queries, you can type it in the chat box, and these may be answered by our speaker at the end of the presentation. After the Q&A portion, only then can we give the lecture code for this session. Another reminder for all of you to kindly keep your microphones muted and video cameras turned off throughout the session. Thank you. All right, now for our introduction of our speaker. Our speaker is a full-fledged Professor 6 and has been teaching for 37 years at the College of Veterinary Science and Medicine of Central Luzon State University. She took her Doctor of Veterinary Medicine, Master's, and doctoral degrees from the University of the Philippines. She is a public health scientist and teaches zoonosis, food hygiene, foodborne diseases, and environmental public health. She was awarded the 2019-2020 CIRCRA Professional Chair and presented a paper on novel diagnostic tests for transboundary animal diseases in a scientific conference sponsored by the Philippine Veterinary Medical Association. Region 10. She is a multi-awarded public servant in education and research, and her works won Best Research Paper nationally and internationally. She is also a technopreneur. She is the CEO and founder of Blitzkrieg Animal Diagnostic Center, a tech startup research and development company that spinned off from the university's Technology Business Incubator program. The company commercializes the patent-pending test kits developed from her researches, providing diagnostic services to farm vets using her affordable test kits, and assists in the capacity building of laboratory personnel from government animal diagnostic laboratories who would like to use her test kits. Not only that, she is married to the director of the Bureau of Animal Industry and has 3 children who are all professionals in their own right. Ladies and gentlemen, Dr. Clarissa Yvonne J. Domingo.
Good, good afternoon. I'm looking for my for my files. Excuse me, I'm looking for my files. Yes. need assistance?
All right, ma'am. Would you like me to share the?
Yeah, please share the file. And
All
can
right.
I? Okay, because
Okay po.
okay, I can't see. I can't see the file. Have you seen it? Okay. Okay. So can I control it? Can I control it? So good afternoon again. This afternoon I'm going to talk on emerging and re-emerging diseases. Okay. So as you can see, this is a slide that shows the map. Excuse me, can you hear? Can you hear me? Hello?
Yes, we can hear you.
Okay. Okay. So let's proceed. Okay, this slide shows a map of the different diseases that as of today, actually, there are 1,415 species of infectious organisms. 61% of these are zoonotic. And 20% out of these zoonoses are known to be emerging infectious diseases that are multi-host pathogens. So you can see the different emerging and re-emerging diseases. Okay, so next slide. Okay, and here we can see that there is a complex relationship between these host populations and other environmental factors that creates conditions for disease emergence. So you can see here that we have the climate change, the wildlife, the arthropods as vectors, and of course the pathogen. Okay. Okay. So before we go move forward, we have to review some important terms. So we have to know the difference between an infection and a disease. It's the presence of a pathogen in the body, but does not necessarily mean an animal can be positive in the test, even though it doesn't show any symptoms or clinical signs, but it is infected. And this is very dangerous because these infected animals can serve as carriers to susceptible healthy ones. But for a disease, this is a condition where cases and outbreaks are caused by a pathogen in a population. And usually, of course, clinical signs and symptoms are seen or manifested in the animal. Okay, animal and human diseases are classified in several ways, depending on the criteria, such as infectious and non-infectious diseases, contagious and non-contagious diseases, zoonotic and non-zoonotic diseases, and acute and chronic diseases. So these are the different ways of classifying the disease by criteria. So let's now define what is an infectious disease. Usually, infectious diseases are caused by a virus, or it could be caused by bacteria, mycoplasma, fungi, or rickettsia. But among these, the viral diseases are the most devastating and they are difficult to control. Why? Because they usually spread very fast, and unlike other infectious diseases, of course, and there is no cost-effective or safe antiviral antibiotics or drugs for treatment. Now, emerging infectious diseases or EIDs are those that are newly reported to infect a new host. That's why we call it emerging, because it's new. So it is newly reported to infect a new host, reported to have enhanced incidences, or there is a sudden increase of cases, reported in a new geographic range, or it could be caused by evolving or mutating pathogens. So an EID covers a range of infectious diseases of man and animals, which pose a significant threat to both medical and veterinary public health. So how come? Because usually these EIDs get established due to lack of awareness, inadequate diagnostic facility, and lack of expertise. Okay. Among the OIE listed diseases of viral etiology, major changes have been experienced in the occurrence of rinderpest, peste de petit or ruminants or PPR, foot and mouth disease or FMD, African swine fever or ASF, lumpy skin disease, and Rift Valley fever. So these are all OIE listed diseases of viral etiology. But remember, an AID or an emergent infectious disease can be a known disease that re-emerges after a long period of time. Now, emerging infectious diseases events have been listed down from 1940 to 2012. And they found out that there were already 335 events in 72 years, which means one event of EID every 4 to 5 years. And and among these 335 events, 216 are zoonotic. %71.8% or 72% of these zoonotic EID events came from wildlife origin. So for instance, we have Nipah virus in Perak, Malaysia, SARS and the novel coronavirus in China. The EID events from wildlife origin increased significantly with time. So from 1990 to 2000, it has increased to 52%. 21% of these EID may be due to drug-resistant microbes, probably related to a corresponding rise in antimicrobial drug use. Oh. Okay. So what about re-emerging? So we have the emerging, we have finished describing what is an emerging infectious disease. Now we go to the re-emerging. How does it differ from the emerging? Now these are diseases of the past, reappearing in an area having a susceptible host population. And an example is the human tuberculosis, which earlier had negative status as a result of very good control measures adopted. However, it reappeared subsequently due to the spread of immunosuppressive human AIDS virus, or our HIV virus. Another example is the introduction of susceptible animal population or breeds from abroad for crossbreeding to upgrade the local breeds in India and other developing countries such as the Philippines. And this resulted to re-emergence of protozoan parasitic infections such as Theileria, Babesia, and Anaplasma. Now, the disease which is introduced from abroad into a country is also termed as exotic. Now, exotic disease and transboundary animal diseases are often interchanged. All transboundary diseases are of exotic origin, but not all exotic diseases are in the transboundary animal disease listing. However, many emerging infectious diseases are also considered transboundary. TADs are highly contagious and transmissible epidemic diseases of livestock, which have the capability for rapid spread to new areas and regions, regardless of national borders and socioeconomic and public health consequences. So in other words, TADs, or what we call the transboundary animal diseases, affect the human livelihood by reducing animal production, productivity, and profitability. Also, TADs threaten human health through inferior food quality and zoonotic infections. So now, the following slides will show the factors driving the emergence of different emerging infectious disease interfaces. Okay, first, we have global travel changes. Okay. Okay, so here, let's go back. So the first driving force towards EID is global travel. So we have experienced changes in the movements of human and animal populations. So for instance, distance and speed of travel have increased 1,000 times fold since 1800s. So there are 1.4 billion air travelers per year. And here, we can see that for the jet setters, no, they can, let's say, take breakfast in the Philippines, lunch in Bangkok, and dinner in Singapore, for instance. So global travel is very fast. So there are also new super vectors. We always say, when we say vectors, we always think about arthropods. But then there are also new super vectors, and these are our cruise ships and our airlines. And then another driving force is urbanization, rural peri-urban, or urban continuum that increase contacts between pathogens and host population. So as a result of urbanization, industrial conversion, animals are kept in densely populated areas. So this increases the contacts between pathogens and hosts that lead to increased exposure and risk. Another driving force is biomedical manipulations. We have learned that animal organs can be used for xenotransplantation. So if the animal has latent infection present, then it can be sequestered by the recipient, which is the humans. So agent contamination of a xenotransplant during harvesting procedure has been reported. And these organisms were Toxoplasma, Trichinella, Cryptosporidium, and influenza viruses. Agricultural intensification also by doing optimal density of animals in a specific location. This is very important to animal health because overcrowding or high densities pose high risks and allow faster transfer of parasites and pests. Again, we have ecological manipulation or human encroachment. So we can see that here when people like to build new subdivisions, they tend to destroy the habitat of our wildlife, and in doing so, they encroach the areas, no, of the wildlife, and somehow this causes or this leads to a slide just move. Yeah. This leads to translocation for wildlife emerging infectious diseases. Okay, so you can see here that you can see during this time when we got locked down in our countries, we got locked down because of coronavirus. So the animals, because we are all inside our houses, the animals were able to go out, no? And go out of our streets. How come? Maybe because our residences are near the forest fringes, and so the animals were able to come. And another driving force, adaptation to environmental conditions. So usually we are talking about the intrinsic properties of the pathogen that are associated, and this could be due to genetic shift as a result of mutation and reassortment, which occurs in avian influenza, conjugation, transformation, transduction that occur in bacteria, adaptation to a new vector and host, and development of increased virulence or drug resistance. Of disease epidemiology patterns. Yes? Ano? Okay. So alteration of disease ecoepidemiology, new disease patterns, and change in vector capacity. So here you can see that when there is epic rainfall events such as 9 days of continuous rain, this synchronize vector host seeking ability of the mosquitoes, and therefore this increase virus transmission. Also, when it is summer and there is a scarcity of, yes, what's the problem? Hello? if there is decreased rain, then we usually collect water in containers. And because there is increased container breeding mosquitoes by forcing increased water storage, no, due to decreased rain. Another is what we call spillover. Now, this one is by which a pathogen is transmitted from wildlife, domestic animals, or to humans. Example is Ebola from monkeys, or between any two species that as those that threaten wildlife conservation. Abortus from a wild elk to cattle. Spillback. So spillback is the spread of a native pathogen in an introduced host and movement back to the original host, resulting in higher prevalence than expected in absent of host. So an example is gecko, which increases the parasite load in the native gecko. Okay. Then another driving force for emerging diseases are the lack or inadequate policies for control and confinement measures. Policies focus on managing and implementing movement restrictions of animals and products from one place to another, especially across borders. So policies and strategies should be improved to safeguard animal health, public health, livelihoods, and food systems. Another is social and cultural practices. Social and cultural practices of man add to the risk of zoonotic transmission, such as food habits, religious beliefs, halal meat, free-range eggs and meat, exotic meat, and raw milk. So you can see the picture, it's a crocodile, you know, that has been, I think it has been grilled. Okay. Another driving force is the management of animal waste. Popularity of organic farming and intensive tilapia. I think everybody knows what tilapia is. So if there intensive tilapia inland farming using poultry manure and other animal manure became a source of added income to livestock farmers. Now, transporting manure to other places because of demand is a risk for transmitting the pathogens. Wet manure is seeded with viable viral, bacterial, fungal, and protozoal pathogens that can be harmful to both man and susceptible animals. And because of this animal waste, of course, this leads to fish kills in some countries. Then we have population density. Of course, if there is increasing human population and even animal population, then this affects the EIDs, or the emerging infectious diseases. You can see that for the less developed countries, the population, no, steeps. It's very steep, but for the developed countries, they remain low. So that's why for the EIDs, mostly the less developed or the developing countries are the ones that are reporting more cases. And here we can see the human population dynamics. So for the developing countries, we have more. There are increasing number of population than the developed countries that is in the blue color, while the developing countries it's in the red. The color of the bar is red. Another driving force is political and civil strife and instability. If there is war, of course, there will be disruption of health services. For example, during the time when Kosovo was war-torn, that led to epizootic rodent tularemia. And then poor or change in public health management. So this is another driving force. Poor or change in management results in lack of integration with animal health surveillance or funding in the public health sector, and sustained funding on scientific studies to answer public health questions and build expertise. As you can see, in our times of COVID-19 pandemic, there are many people who do not like to wear masks. They say their body is their choice. So they do not like to wear or follow the wearing of masks or face shields. Another driving force is climate change and disaster-prone locations. You can see here earthquakes, volcanic eruptions, tropical cyclones, and floods. Of course, here in the Philippines, in 1 year we report 20 tropical cyclones per year. So because of this, of course, that affects the emergence of these infectious diseases. And because of these disasters, there would be breakdown of public services in charge of disease control. So in case of natural disasters, health infrastructures are damaged and control of diseases that emerge from the calamity cannot be mitigated efficiently and effectively. So some of us have read, well, anyone, the Bible can be read by anybody, of course. But here, it is said here, according to the Bible, it has already been prophesied in the future that pestilences will come. Nation will rise against nation, kingdom against kingdom, and there will be famines, pestilences, earthquakes, environments. So, but it doesn't mean that it's already doomsday, because we can still do surveillance to help control. In the meantime, help control these EIDs. And surveillance serves as the brain and nervous system for programs to prevent and control disease. And in controlling the disease, we need the One Health approach, or the whole nation approach, that involves multi-sectoral, multidisciplinary, multi-targets, and multi-levels. And this requires unity, and unity is defined by Henry Ford as coming together is a beginning, keeping together is progress, and working together is success. So it needs a united effort, not only in that country, but of the entire global approach. So again, as parting words, individually we are one drop, but together we are an ocean. Thank you very much.
Right, thank you, ma'am. We will move on to our question and answer portion. You ready for the first one?
Yes.
Okay. If an EID is the term given to those diseases that occur after a long period of time, then how is a re-emerging disease can be differentiated from this?
The re-emerging disease, no. EID can be a re-emerging disease. Okay? So an EID, but if it has been, if that disease has not been reported for decades and suddenly it appeared, but infecting a new host, infecting a geographic area, and using another strain, or because there was an evolvement pathogen, then that becomes an emerging. But of course, it could also be a re-emerging if it happens. Let's say, for instance, in the Philippines, we have gotten rid of rinderpest for a long time. But if rinderpest suddenly appears, then it could be an EID, but has re-emerged. But it should be the length of time that it could be considered a re-emerging if it is only short. But if it's been for a long time, then and it has changed, the sequence, the genome sequence has changed, it can be considered emerging or new.
Oh, right then. Thank you, ma'am. Why do diseases keep on re-emerging?
Okay, as I have said before, I have showed many slides already. So driving force of the emerging diseases. But then, if these emerging diseases have been mitigated and suddenly it erupted again, such as an example is human tuberculosis, because for human TB, for instance, it re-erupted or re-emerged because HIV has broken down the immune system of the patient. So that patient does not really die of HIV, but died of tuberculosis because the susceptible or the patient has no uh, immunity to fight back tuberculosis. To think that TB is just a bacteria. Some
Hello, ma'am.
of you, if you were able to follow the presentation, I have written down less than 20 reasons for how an emerging disease come about. Just go back to the slides.
Oh, okay. Okay. For our next question, since birds can be a source of infection, is it possible to control diseases brought about by these migratory birds?
Okay, for the migratory birds, it's very difficult. Let's say, for instance, flies. For instance, our arthropods, it's very difficult to control this. Likewise, migratory birds are also difficult because they really come and go, and they come in your place in flocks. Okay, so it's very difficult to control. What we can do is to provide vaccines, okay? Vaccines to our animals so that even if they are exposed to these migratory birds that are positive, for instance, they are carriers of viral infections, then our animals are protected.
I see. Right. Let's go for another one. When EID occurs in some areas, what is the first step to prevent the spread and identify the pathogenic agent?
Okay, so here, surveillance is very important, and we have two kinds of surveillance, the passive and the active surveillance. So usually, these emerging diseases come from another country, okay, and it enters without us detecting it, and suddenly our susceptible animal gets infected. During the time that our susceptible animal gets infected until the clinical signs appear, what our vets should do is, upon learning the reports from other countries, they should start doing passive surveillance. Passive surveillance means that they should be doing random sampling and testing the animals that are supposedly susceptible for that disease. And usually, for passive surveillance, we use screening tests that are highly sensitive so that they detect the disease or the pathogen. And while doing that, we should be doing also preventive measures because the infection has not entered our territory yet. But then, if supposedly our animals got infected, and start showing signs, then we can now do our control measures. Preventive measures are done if the infection has not entered yet, but control measures are done if the infection is now being reported in order to reduce the number of cases. And here, by the time that the reports are coming in, and we have now seen that this emerging disease from other countries has entered our country or our territory, then we start doing active surveillance. So active surveillance plus control measures should be together. Okay?
Another question. I think this one is a good one. Which one of these do you think has a higher chance of just transmitting disease from travel? Is it human traveling or livestock shipping? And how do these activities affect TADs?
Okay. So as we have said, a TAD is considered exotic disease also because your country does not have that yet. So when it's the first time, then that's a TAD or an exotic disease. And for humans that are traveling, what the actually the when you say again, can you I think can you repeat the question again?
All right. Which of these has a higher
Which
chance of transmitting disease
higher
from travel?
chance?
Yes.
Okay, higher chance of transmitting disease. Now, for humans, of course, there are very few. We are veterinarians, right? So we are talking about animal diseases. So there are very few human diseases that can be transmitted to animals. But animals that are shipped, and this, for instance, they are already incubating during transport. When they arrived in the country, nation, then they are most likely to start transmitting the disease. That's why it's very important that before you buy the animals, they should be negative of any disease. Because if they're already incubating from the country of origin and they are transported, the stress, the stress will really cause the infection to erupt, and become, it will fulminate, of course. Now, for the humans, if we're talking about human disease too, human disease also, then of course, that is very risky. But humans affecting animals, only few diseases, zoonotic diseases that has zooanthropogenic transmission direction, very few.
Right, thank you, ma'am. For our last question, when we've eradicated a disease from a long time ago, and suddenly that disease emerges again, is it possible that that disease could become more infectious and severe than before?
Well, yeah, it's possible because as time goes, then that the genetic uh, composition of that pathogen can change because of many pressures from the environment, from climate change. No, they have to survive. No, survival of the fittest is the one that is very important here for a pathogen to lengthen its existence here on Earth. But then that only occurs more if we talk of viral disease, viral pathogens. But for parasites, for protozoa, not so much. It's more on viral organisms.
All right, thank you, ma'am. Thank you so much, ma'am, for answering all the questions. Everybody, Dr. Clarissa Yvonne Domingo, we would like to thank you again for joining us in our symposium. And thank you, ma'am. Salamat po. And our session code, the lecture code for this session is all in lowercase. I will say it clearly, M96, M as in mama, WL. Again, M as in mama, 96, MWL. I hope you all got that. All right. I think that ends our session for today. Thank you so much for joining us. And we'll see you tomorrow morning again for the next session. Salamat sa pagdalo. Bye-bye.
See you. Bye-bye.
Bye-bye. Dog! Naririnig.